a lot of us in here, we always reference Katrina. Something happened. What did Katrina trigger as far as opportunities? And I think what I'm going to share with you is that. During the time of Katrina, I was working at the Baton Rouge General, and we received evacuees from the New Orleans area. I was extremely frustrated when we received patients and we had absolutely no idea what their medical history was. And the one case that stuck out in my mind, just like Paula has cases that stick out, was a young woman who had been diagnosed with cancer and had already started her chemo and radiation treatment. And we had no idea what type of cancer she had, what chemo she was receiving, or what her radiation oncology program treatment plan was. And to think that, you know, we were in this age of dealing with that, it was appalling. And so at that point in time, I made a personal commitment that I was going to get involved in any initiative that would prevent something like that from happening again. And so, you know, what happened was really unusual is that we had Region 1, New Orleans, and Region 2 get together and come up with a plan. The first thing was we got together and we were all cooperating, which was unique at the time. But what happened is we realized that we had to put our competitive natures aside and put the patient first. And what has happened since then is we have built on that and developed a very robust health information exchange. All right, here's where we are now. At the end of May, we're going to have, and before, let me just preface this. We received a grant for the state. We're the state designated entity. We received a grant to develop and implement the State Health Information Exchange. We got $10.6 million. Now that sounds like a lot of money, but anybody who's implemented an electronic medical record or anything like that knows that that is a drop in the bucket. So what we did is we got with our stakeholders and we said, how can we utilize this $10.6 million to implement an exchange and sustain it and make it meaningful? And based on feedback from our providers, what we decided to do was use the cloud-based approach, which is the most realistic and practical approach. And so because we had them at the table, people have been willing to sign on and say they're willing to share information with their competitors, which is something that you don't hear of these days. So what is in green and the size of the sphere tells you, kind of gives you an idea of the number of participants in the location of the state. So the green is the people who are live now or will be live at the end of May. What's in blue is who we're predicting that will be live in September. And when I say live, it means they are interfaced, it's been validated, and they're actively exchanging health information. Okay, the only difference here is that by September, we've made the greens, all the dots green. What's in yellow, and Paula, you'll be excited about this, are the school-based health center clinics in the state. We are interfacing all of them. We're also working to interface the public health units and working to interface the Department of Corrections. So what's exciting is that you have the health information electronically available and you add telemedicine to that. It is unbelievable, the potential that we can have here and the outcomes that can be improved. By the end of the year, this is what we feel our state's going to be. And let me tell you something. This is a conservative picture. And this is only showing independent clinics, physician clinics, hospitals. It's school-based health centers. What I didn't share with you is that Acadian Ambulance has also signed on so that they are exchanging health information prior to even getting to the ER. And this is going to happen throughout the state. I think the message today is that Louisiana is poised to do something really great, building upon the work we did. We are doing with the Louisiana Health Information Exchange and working with physicians with electronic health records. If you leverage that and add telemedicine and telehealth, the potential for Louisiana in improving outcomes is outstanding.
Healthcare costs are unsustainable. I think as you look at our budget deficit today, there's significant pressure on both our legislators and also our employers relative to the cost of healthcare. Today, 10,000 members a day are aging into Medicare, so a significant amount of individuals are coming into Medicare. We have $700 billion of the $3 trillion that we spend in healthcare a year wasted. And so we see a significant burden going on in our society, both because of the aging, because of the flawed system, but in addition, we also see an unhealthy population. Today, about 70% of the population in America is either overweight or obese. That has changed considerably from about 25% 3 decades ago. So you have this combination of aging, unhealthy, and a flawed system that's putting a lot of pressure on the healthcare costs in that regard. When we talk about a flawed system, we're really talking about fee-for-service and the fragmented aspects of the industry overall. We see is moving from sick care to health. And I think moving that through a system that not only focuses on when the individual is needed to be treated, and there is some episodic or some chronic aspect, is it's really getting with their journey of health. And I put these words up here just to describe how we see healthcare moving and why we're excited about the future of healthcare, where we see healthcare transforming from where it's needed when something happens to the ability to have a much broader relationship around their health. And I go back to those companies like a Starbucks, like a Charles Schwab, where they transformed an industry that was very much of a transaction industry to an industry that really embraced and helped people in their particular area, but did not allow the transaction to be the business model. The business model was really assisting people and really helping them in what they saw was the need. So in the particular case of Starbucks, it was establishing a community. In the particular case of Charles Schwab, it was establishing a retirement plan for an individual. But we do believe that healthcare will not be solved in the future. That $700 billion of waste that we have in the sector will not be by one individual. We think a partnership with the government is an important part, and we see that continuing to take place over the coming years, whether it's through exchanges, Medicare Advantage, demo projects, et cetera. So we see the government an active part of this in our partnership. We also see a very active aspect of the individual. As Tony articulated, individuals need to take more responsibility of their health now and in the future. We also see it a very active part of the employer. We see the employer changing from just buying health insurance benefits to really providing health and the ability to engage with their customer around a broader aspect. We've seen it in our 44,000 associates where as we begin to engage in their wellness and well-being, the engagement scores go up and the productivity improves as an organization. So we don't see healthcare being solved in one way. We see it solved in multiple ways, and we see it being solved by multiple partners through the system.
We're managing the most sweeping piece of legislation, U.S. legislation, in the last 50 years. The original estimate by the Congressional Budget Office was $900 billion. The most recent estimate is $2.7 trillion. We can't swim away from it. It's huge. And in that piece of legislation, there are many consequences and unintended consequences. Let's talk about a few. We were going to expand care to 30 to 50 million more Americans, correct? When you put an insurance card in that many more hands of Americans, the unintended consequence is there's a potential for a shortage of practitioners to see all those people. How many people in the audience today are beginning to hear a little bit about concierge medicine? Yeah? It's creating another tier of healthcare in the marketplace. Who would have ever thought, as 10 years ago, physicians and practitioners were marketing for patients, that now not only are they not marketing for patients, they're creating country club fees in order for you to come see them. That, my friends, is a game changer. And so we're going to have to do something to try to find a way. And there are solutions on the horizon to make sure that there's ample care available for all Americans. Another unintended consequence, 50 employees. So the legislation said, let's not penalize the small group. Let's give them a chance to be able to weather this storm. And let's set the number of small group employees at 50. The unintended consequences, that is, people who currently have more than 50 employees are going to be finding ways to get under that 50 mark. People who currently have fewer than 50 are going to stay under 50 and may not be expanding their business model. So I would suggest to you, until such a time as there a fix for that, that there's going to be an economic impact that was unintended. Wouldn't you? One of the other unintended consequences, healthcare costs. The Affordable Care Act. I'm afraid not. There are a lot of things that are going to go into complying with this piece of legislation. If you think about essential health benefits, typically that's a healthier benefit package than what's typically being sold in the market today. Think about metal products. Think about actuarial value calculators. Think about the 3 R's. Think about compressing the community rating laws in the state of Louisiana from 10 to 1 to 3 to 1. Think about the taxes alone. There are some insurance companies across America whose tax obligation is greater than their net operating income. I think this has some pretty significant financial implications. So what we're left with is a need for us to manage a lot of change. Where we see a need to get more aggressive, and I think it's going to be very consistent with all of our panelists here today, is to find a better delivery model for Americans to access. We have a broken system. It's unsustainable. Going from 18 to 20% of the GDP and continue to rise, it's game over. What we have to do is to find a way to engage the provider community, to be more collaborative, to find ways to build more accountability into the consumer. And where we are focusing our efforts in that regard is through these new Quality Blue or high performance networks, what's more recently known throughout the press as patient-centered medical homes. Now just imagine this for a minute if you would. Right now you're sitting at home, there's a problem that occurs with a child, a loved one, or whomever, and you're wondering, who do I go to? Imagine if you could just make one call to the primary care physician, and let that primary care physician's home be your quarterback for your health care. The purpose of which is for the insurance industry to provide data and information to that primary care physician, so that the data can be used to best determine the most appropriate course of action. Because right now they're operating in a vacuum. So the responsibility of the provider community, and when I say primary care, I don't mean just physicians, because we're going to go back to the access issue. When we talk about primary care, I'm talking about physician extenders as well, nurse practitioners, physician's assistants. These are the people that we're going to have to count on to triage health care, so that a physician's practice in primary care today that's seeing 50 people can see 150 people through their practice. That person may only see 40 people under the new model because we can triage care through a different level of provider. It's been proven there's a tremendous amount of satisfaction. We can handle the volume. So one of the ways to handle the access challenges in America today, and those that are on the horizon, is going to be for this marketplace to embrace primary care. And we're going to need your help. We're going to need the help of everybody in this room. Because as Americans, it's only natural for us to kind of continue to do the things that we've been doing before. But as a payer market, we have to find ways to engage and collaborate with the provider community, find ways to manage that 10% of the population that's gobbling up 70% of the healthcare dollars, and pay those primary care physicians more money to more proactively manage the care. You get better care with your cats and your dogs through the veterinary when they reach out to you and say it's time for your dog Snoopy's shot. There's nothing like that to speak of in healthcare. We have to create the system whereby we reward and incent the physicians community to reach out and proactively better manage the care of Americans. It's going to lead to better satisfaction, and it's going to lead to better cost. I also want to make a mention right now to you about this storm that's on the horizon that's coming in effective 10/1 called exchanges or marketplaces. Come about June, I think we're going to see a storm of sorts in the press, in the media, trying to figure out how we're going to navigate all these changes in healthcare. A Kaiser study seemed to indicate that 57% of Americans have no clue what's fixing to hit them. And I'd like to see that other 43%, if that's what totals 100, because I can tell you what, everybody I talk to thinks they know, but they have no idea. So my invitation to you today is to join a coalition that's been put together that started with 3 members, and it's now over 60. It's Louisiana Healthcare Education Coalition, the purpose of which is to push information out into the marketplace so that individuals, Louisianians, will better understand some of the challenges that they're hearing on TV and that they're reading in newspapers and that they don't quite understand. The coalition is as big as the Restaurant Association and the medical societies and as small as Paul's Corner Drugstore. I invite you to be a part of the coalition. Find those individuals, your constituency groups that you feel you need to communicate with. This is going to be a good central source of information for you to use.
But at the end of the day, there is so much information that it's going to be up to all of us in this room to help to educate each other, our companies, but most importantly, the insureds that we represent. Look at right now, we've got 157 million employees, independents accessing health care through their employers. So we're all used to that, and many of us in this room are part of that 157 million. We've got 14 million accessing it through individual benefits. 46 million accessing through the system through Medicaid. But as part of the Affordable Care Act, there is an anticipated expansion of Medicaid. And so that some states will be playing in. And of course, ours, we're in Louisiana, we're still on the outside right now of that. But clearly, that will be changing as well. We have 43 million seniors that participate in the Medicare, and as Bruce pointed out, 10,000 folks a day are turning age 65. So more pressure put on that area. And then finally, the 50 million, and that number actually has been debated for the last couple of years. Is it 35? Is it 38? Is it 50? But as best as the experts are saying, it's about 50 million, and that's the folks that would be considered uninsured, which the Act was supposed to, or was intended to address a lot and get a lot of those folks insured through exchanges and through other methods. But went too far. So, one more. So, where we are right now, what the expectation is that even with the exchanges and what the experts are saying on the redistribution, that we're going to pick up about 32 million. In the next slide, we'll cover that. We'll pick up about 32 million, but there'll still continue to be about 18 million is what the estimates are that will continue to be uninsured. And this is really the one that I wanted to get to, and that is what is happening. So what we're saying is that approximately 30 million individuals will be newly insured. 80 million are likely to switch their coverage. More than 20 million are anticipated to purchase their health insurance through an exchange. And more than 15 million are expected to be affected by the Medicaid expansions where they take place. So many of the new insureds are also going to be lower income. And this projection comes from the CBO and the Lewin Group, who have kind of estimated where this distribution of insureds will go as a result of the changes that are taking place. So that's some of the competitive factors that are associated with where our population is going and how we can see that shift. So just a couple of facts here about it. So for every 100 employees or folks, they're saying today, the statistics are that 67 are overweight or obese, 50 have high cholesterol, 39 do not exercise, 33 suffer from stress or anxiety, 25 from high blood pressure, and 21 smoke. Over the past 25 years, adult obesity has doubled, childhood obesity has tripled, and obesity alone is responsible for increasing annual health care costs by $200 billion. So that is the nation, that's clearly a nation that needs wellness. But we're not doing so well here in Louisiana as well. And you know, they didn't name a 50th this year. So United Health Foundation, America's Health Rankings come out every year, and normally there's a 50th. Well, we tied with, we used to say thank goodness for Mississippi, or vice versa. Mississippi would say thank goodness for Louisiana. So they decided to get rid of that debate, and when they looked at the statistics, we were actually tied for last. So Louisiana and Mississippi are actually 49th in health rankings in the country. So when you look at some of the statistics that make that, some key stats include 1 in 3 adults, or 34%, are physically inactive compared to 26 nationally. 1 in 8 Louisianians have diabetes compared to 1 in 11 nationally. 26% of the population smokes in Louisiana compared to 21% nationally. And over 33% of our adults are considered obese compared to 28% nationally. So can correcting some of these behavior patterns really begin to impact cost? Well, it can. And a few examples are that what the statistics that have proven out is that if an individual loses weight, and it doesn't give the specifics or the amount and so forth, but someone being obese or overweight would represent a potential impact or lowering of healthcare costs by $2,500 a year. More effectively managing a chronic illness, $2,400. If they stop smoking, $1,700 a year. And if they select a specialist rated for quality and efficiency, in the case of United Healthcare, where we do rank the physicians based on efficiency and quality, over $1,000 in savings per episode can be saved.
Let me remind you, this is also, by the way, the free market solution that encourages competition at each level of the value chain, that surfaces the best service providers, whether they be individuals, a small firm, or a large firm. And also the free market answer that protects and ensures not only my well-being and my business model, but I think your business model, the producer's business model. So reform is moving ahead aggressively, and we've had to move ahead aggressively as well, whether we like what's rolling over us or not. And I'm certain each of us has felt this way this year, more than once. But that big steamroller of reform is gaining momentum now. You've heard it said already on this panel. If we're not alert and prepared for 2014, if we're not alert and prepared for the healthcare exchanges, and if we're not alert and prepared for the open enrollment period coming in October, then our fates are both clear and they are unattractive. So, for those of you who were in this same meeting in April of last year, you will perhaps recognize this slide. It's part of my 2012 message. It's a reprise because the situation is, as I said, the same. Only one thing has changed. We have 1 year less to prepare, 1 year less to prepare for our near-term futures. And for none of us will those futures be the same as they are today. The key message today is we're in the same boat we were a year ago at this time when we had the last commissioners' conference, and that message is healthcare reform is changing everything about our business models. We've just got 1 year less now than we did last year to plan for it and to secure our futures.
Tell us, what are the biggest challenges that you see facing Louisiana residents that have insurance and those that do not?
Really, it's going to be around all the changes that are going on and understanding those changes, what comes down in 2014.
Well, I can tell you this, there's a lot of misinformation. And what we're trying to do right now is to promote a coalition, the Louisiana Healthcare Education Coalition, the purpose of which is to push information out into the hands of the community to help them better understand and navigate all of the changes that are occurring in healthcare.
I think there is clearly still so many unknowns about the cost impacts of implementing all of the aspects of reform and additional taxes and so forth that will have to play into to the development of rates.
What are the biggest challenges that Louisiana residents face when it comes to October 1st and the start of the Affordable Care Act, both those with insurance and those without insurance?
Well, it's going to be a cost issue, frankly. All of the mandates and expansion of coverage that was required by the Affordable Care Act, as with everything else, there's no free lunch, came at a hefty price. And there's going to be significant rate shock for consumers statewide. I hasten to add, we're one of the few states that don't regulate health insurance rates. So whatever it is only governed or regulated or controlled by what's called the medical loss ratio that's embedded in part of the Affordable Care Act. A good part of the Affordable Care Act, I might add. It does limit the profitability of insurers doing business in the health insurance arena. But the other aspects of it, mandating that everybody have coverage, universal accessibility to coverage for everyone, regardless of health condition, comes at a price. The political decision to cap rates for elderly folks shifted that cost to young invincibles, as they are generally referred to, folks in their 20s and 30s who are the greater part of our uninsured population. And that problem, I think, unfortunately, will be exacerbated by the fact that their cost is going to go up significantly come October 1st.
When today's conference is over, what would you like people to keep in mind?
Well, I would hope that they would know that they can come to us through our website, www.ldi.la.gov, or just reach out by phone, our 800 number, 259-5300, to fill in the gaps if they're uncertain about some part of what is presented here today, whether it's Medicaid or cost of insurance or navigators or any of the aspects of the Affordable Care Act that will impact them. We can fill in those voids of knowledge for them and assist them in understanding and dealing with this new world that we are about to venture into called government health care.
And the website for the department one more time is?
Sure, it's www.ldi, Louisiana Department of Insurance, .la.gov.